Virgil Straker, 9mm GSW to the left shoulder, CT angiogram negative.
GSW is a short form for gunshot wound. CT angiogram is a procedure where we use a CT scan with contrast dye to visualize the blood vessels. CT angiogram negative means that there was no dye spillage, which means the gunshot wound didn't cause any blood vessel around the left shoulder to rupture and the blood vessels were intact. If there was vascular injury, it would have had to be repaired surgically by a vascular surgeon.
Surgery wants to admit for overnight observation.
Good vitals. They repeat a crit?
Stable crits every 2 hours times.
When they say crit, they're referring to hematocrit, which is a test to measure the percentage of RBC in blood. Basically, bleeding due to a gunshot wound. If it's excessive, it could cause drop in hematocrit. Sometimes, even if the patient is being resuscitated with IV fluids, the hematocrit still decreases, which might indicate internal bleeding. So having a stable hematocrit is a good measure of patient's well-being in this case.
3.
Discharge on Sefton. Recheck tomorrow. He'll get way more rest at home.
Sefton is a brand name for cefuroxime, a type of antibiotic under the cephalosporin class, basically given here to prevent infection of the wound.
Good morning, Mr. Straker. You want to go home?
Hell yeah.
Okay.
Hey, bro.
Murphy Rottenstein, 48-year-old woman with cirrhosis and upper GI bleed.
Cirrhosis of liver is a complication of chronic liver disease, where the liver tissue gets replaced with fibrosis or scar tissue, the most common cause of this being alcoholism. Over time, due to this scar tissue, blood flow through the liver gets obstructed. This can lead to what's called a portal hypertension. This can then lead to enlarged veins in the esophagus called esophageal varices, which can bleed and cause upper GI bleeding. So, naturally, we'd expect the patient to be a chronic alcoholic unless the symptoms could be explained with other causes.
Intubated and stable after 1 unit. Awaiting ICU bed.
Yeah, patients like such are transfused with units of blood, put on IV proton pump inhibitors, drugs like octreotide, and yes, they require urgent ICU admission for their recovery.
Hey, Doc.
And we all know Louis Cloverfield. Blood alcohol of 420 at 11 p.m.
A blood alcohol concentration of 0.4 or greater could cause respiratory failure, coma, and death.
I've been cutting back.
How is he still breathing?
That's a lethal dose for you and me. That's happy hour for Louis.
Sobered up, had 2 rounds of lorazepam.
Lorazepam is a drug used for alcohol detoxification and to treat alcohol withdrawal symptoms. The reason why he is mentioning sobered up is that you'd have to wait at least 12 hours from the point of taking alcohol before taking this medication. Since this guy is a heavy drinker, it would be advisable to wait even longer, likely 24 hours before putting him on lorazepam. If not, both the drug and alcohol act as CNS depressants and can cause drowsiness and respiratory depression, leading to difficulty in breathing.
Hold out your hands for me, Louis. Another 2 lorazepam.
On it. And a script for Librium.
The shaking of hands which is being displayed is called a tremor. Tremors are common symptoms of alcohol withdrawal. This can be accompanied by delirium, where a patient is disoriented and acts confused, also called delirium tremens. It's a complication of alcohol withdrawal. Librium or chlordiazepoxide is another drug of the same class as lorazepam, but is more long-acting.
It's good to see you, Louis.
It's always a pleasure, Doc.
Bar fight with complete avulsion of tooth number 8. Smile, Charlie.
Oh, where's your tooth, Charlie?
Fuck if I know.
Cancel the discharge, order a chest x-ray. Gotta rule out aspiration.
In all cases of trauma, usually X-ray of chest, ECG, and USG fast scan are done to rule out various pathologies throughout the body. Due to trauma, we don't just observe the body part that was hit by trauma. Sometimes free fluid, that is blood, gets collected in different spaces of the body like chest, abdomen, and pelvis that are missed and could lead to complications. Here, due to trauma to the head, the tooth got missing, and this could have been accidentally inhaled into the airways and possibly lungs. This is called aspiration. Could be seen on an X-ray chest, so it was ordered.
Incoming!
42-year-old male Sam Wallace, blunt head with agonal respiration.
So the patient had a blunt force trauma to the head, and now he has agonal respiration. Agonal respiration means abnormal breathing pattern, where the patient is gasping for air, basically shallow breathing. In this case, there could be a subdural or intracerebral hematoma due to head trauma that could have compressed the brainstem, or there could be reduced cerebral blood flow due to airway obstruction that could cause cerebral ischemia. Either way, There could be brainstem injury leading to this pattern of breathing. The first thing to do in such case would be to secure the airway.
Drop down the T-tracks. Couldn't tube them, LMA in place.
Suicide attempt?
The best way to secure airway is to intubate the patient. Here, an endotracheal tube is placed using anesthesia. In cases where intubation fails or until intubation is available, like in this case, a temporary airway rescue is done using a LMA or laryngeal mask airway. This device is placed over the vocal cords. This is done so as to directly deliver oxygen into the patient's airway and minimize the work of breathing.
Rescue. He's a good Samaritan. Took a spill helping the woman who fell off the track. She's right behind us.
Okay, trauma one. Go.
So, this is the ambu bag connected to the other end of the LMA, which is connected to this oxygen tube here.
Woman fall from T platforms, good vitals, no head injuries. Degloving injury, right lower leg with open fracture, dislocation of the ankle.
Degloving injury means the skin and the subcutaneous tissues are ripped away, exposing the underlying muscles. This type of injury usually occurs if the trauma involves shearing forces pulling apart the superficial skin structures away. Also, an open fracture is when the fractured bony segments are exposed out of the skin. These are prone to infections, especially osteomyelitis or infection of bone, which is difficult to treat, and hence it's a medical emergency.
Okay, trauma two, let's go. How we doing, ready? Okay, here we go, ready? 1, 2, 3.
Good breath sounds bilaterally, but we need to protect his
Apparently, he jumped down to save the lady. When he climbed back up, he slipped, fell back, and hit his head.
Thanks.
It's more of an R2 procedure. Mel, right? I need you on the E fast. Pupils 4 millimeters and react.
A largely dilated pupil that doesn't react to light being shown could indicate a brainstem injury, possibly even herniation, hence it's important to check.
Okay, that's encouraging.
What do you want for meds? 120 ketamine, 80 of rock.
Ketamine and rock or rocuronium, both are drugs used for general anesthesia here.
AFib on a monitor. Morrison's clear.
That's a lot more blood than expected.
He's probably anticoagulated for AFib.
AFib or atrial fibrillation is a type of heart arrhythmia where the upper heart chambers called the atria are enlarged and contract abnormally, which doesn't allow blood to be efficiently pumped into the ventricles or the lower chambers of the heart. This can be observed in an ECG or, like in this case, on an ECG monitor. Interesting thing about atrial fibrillation is that if the blood doesn't get pumped down into the ventricle, it gets collected in the atrium and this can cause blood clots to form. To prevent this, patient is usually put on an anticoagulant like warfarin and newer alternatives to warfarin, which are called direct oral anticoagulants or DOAC, like rivaroxaban or dabigatran. These are blood thinners and can cause excessive bleeding, so a lot more blood on the head trauma site here, or could even predispose to hematomas in the brain like subdural or even intracerebral.
Check his medical record, see if he's on a DOAC. Standby with 4-factor PCC if there's a brain bleed.
In cases of internal bleeding due to warfarin, 4-factor prothrombin complex concentrate or 4-FPCC is given, which is a blood product that contains 4 coagulation factors, 2, 7, 9, and 10. Since the mechanism of warfarin involves inhibiting the activation of these 4 clotting factors, transfusing these clotting factors directly would reverse its effect, hence it would be useful.
What's the PCC? No.
Clotting factors 2, 7, 9, and 10.
Okay, be right back.
50 of Fed, didn't touch her.
Did she faint or did she trip off the platform?
Nobody knows. The other guy jumped down, pulled her off the tracks just as the train was rolling in. Isolated injury to the foot.
The train ran over her foot.
Got caught between the platform and the incoming train.
Ma'am?
All right,
Ma'am, what's your name?
Fracture, 2 grams, sepsis.
Cefazolin and gent or gentamicin are antibiotics used to prevent or treat infection in an open fracture, in this case, which is fracture with bony segment exposed out of the skin. Type 3 means that the open wound size is more than 10 centimeters, or with extensive soft tissue or vascular damage. 50 of Fent means that she was given 50 micrograms of fentanyl, which is a very powerful synthetic opioid drug used as an anesthetic and analgesics in cases like this, where the pain is severe and intense. 50 of Fent didn't touch her means that the dose of the drug had no effect on her pain relief and she was still screaming in agony.
Airway and breathing are perfect.
As is circulation, BP 140/85.
Airway breathing circulation. The ABC is what we check for and manage at first during any emergency case. The wound is gross with extensive soft tissue damage, likely a degloving injury where the skin and tissue beneath have been peeled off, exposing muscles and fractured bone segment.
Students,
20 cc's of
what might have made her faint on the platform?
Could be an arrhythmia, cardiac event. So she needs.
TIA, or transient ischemic attack, means temporary blockage of blood flow to the brain. CVA, or cerebrovascular accident or stroke, which means permanent blockage of blood flow to brain. Cardiac arrest means when the heart suddenly stops beating. All of these could cause sudden fainting and collapse of the patient. Relevant investigations would further narrow down the diagnosis.
EKG and troponin.
Okay, good.
Got party people.
Subway train degloved your foot with an open fracture dislocation.
Ooh, and I thought my heels were painful.
Dynamically stable.
EFAST negative.
EFAST, or Extended Focused Assessment with Sonography and Trauma Scan, is an ultrasound scan done in a trauma patient to detect collection of free fluid or blood in body spaces in the chest, abdomen, and pelvis to rule out life-threatening conditions like hemothorax or hemipericardium, which means blood in the pleural or pericardial cavity surrounding the lungs or heart.
I'm Dr. Yolanda Garcia. Any pain in your chest or belly? Can we please push the morphine?
No, it could cloud her mental status.
I can't do an exam like this. Push the damn morphine.
Morphine is a CNS depressant, could lead to respiratory depression and respiratory arrest if given haphazardly.
We're doing a popliteal block. Numbs the lower leg, no side effects.
Popliteal block is a regional anesthesia technique that numbs the lower leg below the knee by blocking the sciatic nerve. It's commonly given for procedures involving the lower leg and pain relief, as in this case.
Wonderful. Where's the other guy?
Next door. He's a bit worse.
Pan scanner, let me know when she stops screaming. The cords are very anterior. Yeah, that's because we can't flex the neck. Keep the hockey stick straight up. I'm in.
Let me guess. This is probably an intubation procedure where the vocal cords have been visualized, and this is probably of the patient who had a laryngeal mask airway on before, the one who had agonal respiration, the good Samaritan guy who tried to save the lady with the degloved leg. So this is the picture of vocal cords, and this is the endotracheal tube, which is inserted into the vocal cords and sealed onto the trachea. This way, the oxygen directly goes into the trachea and lungs through the tube and assists the patient in respiration.
Good. Well done.
Bring me up to speed. Intubated for agonal respirations, GCS-5, probably anticoagulated.
Glasgow Coma Scale is an assessment tool used to measure a patient's level of consciousness. A GCS of 5 means the patient has severe brain injury due to the blunt trauma sustained in the head while trying to save the elderly lady from the train.
With what? First time here, there's no medical records. All for FFP?
No, we got 4-factor PCC.
FFP means fresh frozen plasma, which contains all coagulation factors. The PCC contained 4, enough to reverse the oral anticoagulation, so PCC would be more effective for reversal.
80 of mannitol to reduce brain swelling, then right up to CT.
Mannitol is a diuretic, which is used to reduce the intracranial pressure by reducing the brain swelling and excreting excess water via kidneys.
Nerve block complete.
Seems like it's starting to work. It's 10 minutes for the full effect, and the Marcaine lasts a good 4 hours.
Marcaine is a trade name for bupivacaine, the local anesthetic that the doctor used for the popliteal block of the lady to relieve pain.
How we doing?
Vital stable.
I like these two.
Any chance she jumped?
She may have been pushed.
Jesus.
Yeah. Could be looking at a possible hate crime.
We need to talk about your numbers.
People we've saved?
Metric.
Let me guess. This is someone from the administration. The hospital just wants doctors to see more patients, perform more procedures, and make more money for the hospital. That's it. So no doctor really wants to talk to them. After all, that's not what we went to the medical school for.
Our door-to-balloon times beat federal standards.
The door-to-balloon time means the time between a patient with a heart attack or myocardial infarction, or MI, arriving at the emergency department, which is the door, and for a catheter to be inserted and a balloon to be inflated into the blocked coronary artery as a standard procedure of treatment for MI called PCI, or percutaneous coronary intervention. Basically, the time it takes for a patient having a heart attack to be surgically operated for it and blockage to be relieved. The standard here is 90 minutes. If it's less, that means the emergency department is really good at taking care of patients and immediately referring the patient to the specialist. Something to be proud of if you are in charge of emergency. That reduces mortality of patients with MI, specifically ST elevation MI, a type of MI where the ECG shows ST elevation.
I'm talking about Press-Ganey scores. Patient satisfaction?
If they're still alive, they should be satisfied.
Our goal is 36%, very satisfied with their care. Your department is at 8. Do you know how likely patients are to recommend this hospital?
This is an emergency department, not a Taco Bell.
11%.
Well, if you want people to be happier, don't make them wait for 12 hours.
Like, what is the doctor even supposed to do? He is working as hard as he can. The dissatisfaction comes from the fact that there are significantly more patients to be taken care of, so maybe hire some more doctors and nurses, I guess. The purpose of emergency service is to save lives, stabilize the patient, and put patient out of life-threatening conditions. The wait before or after the service that makes them dissatisfied shouldn't be upon doctors.
There's a nursing shortage across the country.
Most of our patients are boarders who are waiting for a bed upstairs.
We don't have the beds.
That's bullshit. The beds are up there. You just don't want to hire the staff you need to care for.
Oh, Doc, it ain't working. And whatever they're giving me, it's not working.
No response to max citrate. Should I send in the fleet? Okay, sir, we're gonna try an enema.
This patient is likely suffering from constipation. Magnesium citrate is a saline laxative which softens the stool and relieves it. If this oral medication doesn't work, then fleet is used, which is basically the name of another saline laxative to be used in enema. Enema is a procedure where saline fluid is inserted directly into the rectum to trigger muscle contractions in the colon, stimulating bowel movement, and hopefully clearing the stool out. Usually there is defecation within 5 minutes of administering enema.
The hospital saves money keeping patients down here in the pit. It's way cheaper than staffing upstairs.
I have asked you repeatedly to stop referring to the emergency department as the Pit.
Oh, that's where the name of the series comes from? I thought it was the name of the hospital or a place. Pit, as in the place where the patients are kept for an absurdly long time, 12 hours or more, before they even get a chance to stay in the hospital bed upstairs because of the greedy administration not allowing more staffs, not hiring more nurses and doctors to facilitate their care upstairs.
It is derogatory and incompatible to the institution's image.
You know what's incompatible with the institution's image? Me speaking to the media about people who code in our waiting rooms and people who get shitty care in our hallways waiting for an ICU bed for days.
I've heard about doctors who have tried that and find themselves out of work.
This is what I don't like about practicing medicine. People like this threatening doctors to work for their profits, or else they would fire them. They just are clueless about what our job is, what we go through, and just have one thing in their mind: how to make doctors work more.
Boarding is a nationwide problem. Your predecessor, Adamson, sure as hell knew that. Or wasn't that something he taught you? Yes, really. Other hospitals are managing this crisis much more effectively. So you can either step up your game, or you can step aside.
Threatening using the name of a deceased doctor who was apparently his close friend working in the same place is just next level of low. I'm sure his death had something to do with the stress piled up working in that ER.
Good Samaritan dude has a small left temporal intraparenchymal bleed. No epidural, no subdural, no midline shift in the brain.
That's good news.
You could look.
As we said before, the blood-thinning medication does predispose to hematomas in the brain. Here, it's an intracerebral or intraparenchymal bleed, which means the bleeding occurred inside the brain parenchyma and not between the skull and the brain, like in epidural or subdural hematomas, which is what they meant when they said no epidural, no subdural. No midline shift means that the hematoma is not as big to cause midline shift, which is when the brain parenchyma is displaced across the center line of the brain due to mass effect of a big hematoma or tumor. Ruling this out is important in a CT scan because this could cause significant neurologic deficits due to compression and squeezing of brain tissue.
If an artery is totally transected, the smooth muscle in the tunica media contracts with hemostasis.
But if it's a partial cut, get out your umbrella.
Complete transection of an artery can lead to vessel retraction and spasm at the cut ends, potentially limiting bleeding, while a partial transection often results in persistent and profuse bleeding because the cut area can't contract effectively. Tunica media is the muscular layer of an artery that's responsible for the contraction. The circularly arranged muscles here would contract effectively if the artery is completely cut instead of being cut partially.
Good catch on bar 5 Billy. There's an aspirated tooth on chest x-ray. Would have been dead in a week from a lung abscess that you let him be discharged.
We're calling the pulmonary.
An aspirated tooth on a chest x-ray would look something like this, and yes, the aspirated tooth would act as a foreign body, and the local tissue reaction would convert it into a lung abscess, which is a cavity with collection of pus in the lung. It could be fatal if not treated with antibiotics. Also, tooth aspiration due to trauma like this is rare. It would rather be common with dental procedures, or if the reflexes are weakened due to some neurologic disorder or altered consciousness.
Cardiac arrest, ETA, 10 minutes. Where should we put it?
Anywhere.
We'll have to put somebody in the hall.
ETA means estimated time of arrival is within 10 minutes of cardiac arrest.
I was fine until about 2 weeks ago after the Rochester Marathon.
Okay. Any falls or injuries?
Just tired, sore muscles.
Yeah, I'd be in bed for a month. Was this your first triathlon?
God, no. No, I do one every few months.
Have you seen a doctor yet?
No. I went for a run this morning. Had to quit after a minute. Pretty short of breath.
This goes under your tongue. No current meds, no allergies.
We're gonna check a few labs and an EKG. Draw a red and purple top.
Yep. Temp 98.2.
So this athlete patient developed sore muscles during his triathlon. This could occur because the skeletal muscles had broken down rapidly due to the strenuous activity over a short period of time. This is called rhabdomyolysis, which can present like this with muscle pain and exhaustion. The muscle protein myoglobin, which is released from the breakdown of muscles, excrete via urine and can cause dark-colored urine. The protein itself damages the kidney tubules, causing what's called acute tubular necrosis, leading to intrinsic kidney failure. The excess potassium from the muscles released into the bloodstream can cause hyperkalemia or increased potassium levels in blood. If unchecked, this could cause irregular heart rhythms or arrhythmias, which could be fatal. That's the reason why the ECG and lab tests for checking electrolyte levels were ordered by the doctor.
Take a deep breath for me, Otis.
Little pinprick now, okay?
Otis? Otis? You didn't take him for a lightweight, huh? Oh, shit. No pulse. Crash cart, laying flat!
A patient might faint during venipuncture, which means drawing of blood like this, due to a vasovagal response, which is a reflex causing a sudden drop in blood pressure and heart rate, often triggered by the sight of a needle, blood, or anxiety related to the procedure. However, it could be related to rhabdomyolysis-induced arrhythmias.
Let's check a rhythm.
Saline pads. Quick look paddles.
VTech.
Charging at 200. Charged.
Clear.
All right, it's back to normal sinus.
So, here an AED or automatic external defibrillator is used suspecting sudden cardiac arrest signaled by low pulse. However, a CPR is usually given first when you suspect the person is not breathing and has no palpable pulse.
So what's the plan?
ICU when we can get a bed and admit for supportive care. Repeat head CT in 3 hours, or sooner if he blows a pupil.
So the patient's scalp wound was sutured. A blown pupil means a largely dilated pupil unresponsive to light, which could signify brainstem injury or possibly herniation due to the intraparenchymal bleed over time.
Want a Keprolilla?
Order's already in. Nice job.
Keppra is the brand name for levetiracetam, which is an anti-seizure medication, basically given here to prevent seizures.
Do you think he'll wake up?
Maybe. Maybe not.
Otis Williams, healthy 31-year-old, VTech arrest 2 weeks after triathlon.
So it is confirmed that the cardiac arrest and sudden fainting here was caused by VTach or ventricular tachycardia, a type of arrhythmia.
NSR with 1 shock.
NSR means normal sinus rhythm, which means the heart started beating normally again after a shock of defibrillator.
Pulse 98, BP 110/60.
He's a little young for an MI.
MI means myocardial infarction, usually occurs in older patients with comorbidities like hypertension, diabetes, or high cholesterol.
Exactly right. What's the differential, Dr. Collins?
Drug overdose, electrolytes, on QT, Brugada syndrome, WPW.
Brugada syndrome is a rare inherited genetic disorder that causes abnormal heart rhythms, while WPW or Wolff-Parkinson-White syndrome is also another form of arrhythmias. Both have typical ECGs of their own. However, they are pretty rare and totally unrelated to the patient's history. Also, they could easily rule these conditions out of their mind by looking at ECG. Rhabdomyolysis-induced hyperkalemia causing arrhythmias seem to be more relevant. Let's see what Dr. Jack says.
How you doing there, Otis?
Okay. What happened?
VTech again?
200 joules.
Charged and clear.
Back in sinus. Otis?
Oh, groaning's good. 5 of nasal O2 CBC, CMP, troponin, and D-dimer.
CMP, or Comprehensive Metabolic Panel, includes all the metabolic markers in blood and electrolytes. Troponin would be useful if heart attack is suspected, D-dimer for blood coagulation disorders. However, both don't seem to be really relevant here.
What are you doing?
1 gram calcium glutamate, IV push.
We don't have the labs back.
Look at the monitor. Wide QRS and peak T waves, hyperkalemia.
This is why ECG at the monitor is super important to observe to rule out irrelevant differentials. Hyperkalemia, or increased potassium levels in blood, have typical ECG appearance, like a widened QRS complex, tall T waves, prolonged PR interval. These changes occur according to the potassium levels in blood. Just before, a severe hyperkalemia, likely more than 7.5 to 8, led to ventricular tachycardia twice because the potassium level was not corrected, which then led to cardiac arrest and fainting twice. A systole could occur as well in the most severely elevated potassium, meaning a flatline ECG, causing cardiac arrest as well.
Intense exercise caused muscle breakdown, rhabdomyolysis, knocked out his kidneys. Now he's not clearing potassium. I bet it's over 7.5.
Wait 2 minutes for the ice.
If you rescue, we might not get him back.
This is exactly what we described before. Rhabdomyolysis, meaning skeletal muscle breakdown, caused the direct release of potassium in blood, causing hyperkalemia, which then caused arrhythmias like VTAC, leading to his collapse. Yes, the myoglobin released from the muscles also damaged the kidney tubules, causing acute tubular necrosis and kidney failure, which can also exacerbate increased potassium levels, but the increased potassium is primarily due to its release from muscles rather than the kidney failure, which is also occurring simultaneously. Potassium over 7.5 is deduced from the fact that those typical ECG changes and VTAC that happened here occur at the most severe levels, typically more than 7.5 or 8. Immediate action is required, sometimes superseding the wait time of the lab test results, as Dr. Jack is loading up the calcium gluconate himself. The treatment of hyperkalemia includes first and foremost calcium gluconate IV, the rule of 10%, 10 milliliters IV over 10 minutes. This helps stabilize cardiac cell membrane and prevent arrhythmias due to the excess potassium.
Calcemia, you could kill him. Wait.
It's my ass, not yours.
Hand scan is negative. That means you can admit to orthopedics.
But there may have been a medical etiology if she fainted.
That's not surgical. Get an internal medicine consult or admit to medicine with ortho consulting. Either way, I'm off the case.
Typical debate among residents regarding which department to admit the patient. If the patient presents medical as well as surgical issue, the patient could be admitted to one department with routine review or consult from the other department. Where I used to work, the surgery residents would be very unwilling to admit a patient with a lot of medical issues in the ER.
Okay, thanks for nothing.
And Cefsin, I'll grab the gent.
Ancuf and Gent are cefazolin and gentamicin, antibiotics used to prevent or treat wound infection here.
QRS is narrowed. Much better.
Potassium is 7.7, creatinine 5.6.
High potassium and renal failure. Just what you thought.
Must be my lucky day.
The improvement in ECG was achieved due to calcium gluconate being given that stabilized the cardiac muscle cell membrane and reduced the effects of high potassium on it.
Ordering 10 units of regular insulin and 25 grams of glucose.
Why insulin and glucose?
Besides calcium gluconate, additional drugs are given to lower the blood potassium levels. One of the drugs is insulin that helps to shift the excess potassium from the blood into the cells. However, the problem is that insulin also shifts glucose into the cells, decreasing glucose levels. This would rather cause hypoglycemia, which could also be fatal if not checked. Since this is not a desired effect here, to counteract this, dextrose is also infused. For example, 50 milliliters of D50 with 10 units of regular insulin. This way we would achieve the decrease in potassium levels with the patient's glucose being restored to normal. However, both the potassium and glucose levels need to be constantly monitored to reduce undesired fluctuation and electrolyte imbalance. Other drugs like beta-2 agonists, namely salbutamol, can also be given via nebulization. This also causes intracellular shift of potassium. Diuretics like furosemide can cause excretion of potassium via kidneys, while there are potassium-binding resins excreting potassium via the gastrointestinal tract.
Shift the potassium intracellularly?
Exactly, but the definitive treatment is...
Hemodialysis, I'll call renal and get a tech down with the machine.
I wouldn't call hemodialysis as a definitive treatment of hyperkalemia. If potassium elevation is extreme and not controlled by those medications, then only dialysis could be done as a last resort to directly filter out excess potassium from the blood. The patient's creatinine was 5. The need for dialysis is usually 7 or higher in real-life scenarios of kidney failure, more definitively if the eGFR is less than 15.
Muscle breakdown and myoglobin damaged your kidneys.
Why did you shock my heart?
When your kidneys don't work, potassium builds up and messes with the electrical activity in your heart.
Again, it doesn't have to be kidney failure before potassium can't be excreted and builds up. Just the breakdown of muscles alone releases potassium. It's not the primary reason.
Can it happen again?
We gave you medicine to lower your potassium, and you'll need dialysis to clear it all out.
Only if those medications do not lower potassium significantly, or if the patient suffers from uremia, which means buildup of toxins in blood due to kidney failure, causing effusion or neurologic complications. This occurs if creatinine increases significantly from 5 to around 7 or 8.
Then I'll be okay.
Yeah, you might need a week or two for your kidneys to recover, but yeah, you really need to hydrate like crazy before and after a triathlon.
Hydration could lower the concentration of myoglobin in the blood and allow kidneys to excrete it, along with adequate rest and avoiding overheat and strenuous exercise above your body limits.
89-year-old woman from a SNP. History of emphysema, CHF, MS, VFib, unresponsive to 3 shocks, 2 rounds of epi.
This patient came from SNF, or Skilled Nursing Facility. He has emphysema, a form of chronic obstructive pulmonary disease, CHF, which means congestive heart failure, MS means mitral stenosis, a type of valvular heart disease, and is brought here with VFib or ventricular fibrillation, which is a type of arrhythmia. 3 shocks of defibrillator were given, but the patient didn't respond to that. When a patient doesn't respond to defibrillator shock, the protocol is to give epinephrine 1 mg IV to be repeated every 3 to 5 minutes during continuous CPR attempts. The patient is being given continuous CPR here using this machine which simulates normal CPR.
What is that? Lucas chest compression system.
Robotic CPR.
Was there an advance directive?
No, full cope or the nursing home.
Seriously?
A medical advance directive is a legal document that has written wishes of a patient for medical care if the patient becomes unable to communicate them. An example of this would be do not resuscitate or DNR, which means that the patient does not want to be resuscitated if his heart stops beating.
Lucas off.
Still VFib.
Lucas on. 1 more round of epi, 1 more shock, and then we call it?
Call it means declaration of death, signaling this was their last attempt at resuscitating the patient.
Joseph Spencer, 79, fever and cough from assisted living, has a history of mild Alzheimer's.
Heart rate 130, BP 90/60, gave him 500 cc's normal saline.
The patient is in a state of shock where the BP is low, pulse is high, needs to be resuscitated with IV fluids.
How are you feeling today?
Is it dinner time? I'm not really hungry.
The patient is disoriented with respect to time.
Do we have any paperwork from the facility?
He has a pulse.
POLST stands for Physician Orders for Life-Sustaining Treatment. It's a form that documents a patient's specific preferences for end-of-life care. It's a bit more specific than an advance directive.
IV fluids and medications are fine, but no intubation and no chest compression.
Course Ronchi here.
Right middle lobe infiltrate.
Temp 102. Call code sepsis.
Ronchi are a type of abnormal breath sounds. Could be due to his COPD. Sepsis means body's exaggerated response to infection. Considering the vitals, the patient is likely in a state of septic shock. Lung infection could be a primary source of infection.
2 sets of blood cultures, lactic acid, 30 cc's per kilo NS, a gram of ceftriaxone, 500 of azithromycin, repeat lactic, then 3 hours.
Those were just the names of antibiotics and fluids to be given. The role of lactic acid in sepsis is that it indicates tissue hypoxia, which if increased strongly correlates with the severity of the disease and mortality.
Nice.
I'm so sorry, ma'am. We don't understand you.
Me?
Oh my god, I can understand what she is saying. She is Nepali and is speaking Nepalese. She is requesting the doctor to call her little sister and contact her and tell her sister not to worry. I guess I could solve the language barrier here.
I'm Dr. Heather Collins. I'm from here, Portland, Oregon. Where are you from? Yeah, I can't tell where you're pointing. Tajikistan? Nepal. You're from Nepal.
Nepali.
Otis's BP is crashing, 70/50, still waiting for dialysis.
How you doing there, Otis?
Okay, that's okay.
15 liters non-rebreather, please.
This is the ultrasound probe positioned to visualize the heart, called an echocardiography.
Oh, crap. Diastolic collapse of the right atrium and right ventricle.
Tamponade from uremic effusion.
That's why his BP is low?
Yep.
Too much fluid and pressure around the heart. Chambers can't fill.
As we said before, uremia means buildup of toxins in blood due to kidney failure. These toxins are mainly urea and other unexcreted products. If their levels go high, usually indicated by creatinine more than 8, these can cause toxic effects like inflammation. Effect on the skin would cause intense itching, called uremic pruritus. Effect on the brain would cause confusion and seizures, also called uremic encephalopathy. Effect on the pleura, which is the covering around the lung, can cause inflammation and fluid collection, called as pleuritis and pleural effusion. While these also irritate the pericardium, the covering around the heart. This also leads to inflammation and fluid collection in the pericardium, known as pericarditis, and pericardial effusion, respectively. This was what happened here as well, uremic pericarditis and pericardial effusion. Interestingly, if this fluid around the heart increases, then this would essentially compress the pumping heart. As a result, the heart is able to contract, but is unable to relax fully due to the excess fluid pressure around it. The upper and lower chambers of the heart, also called the atrium and ventricles, are unable to relax, and hence are also unable to fill up with blood. This is called reduced diastolic filling, or basically diastolic collapse. This can be visualized on an echocardiogram like in this case. This tamponade effect of the excess fluid around the heart doesn't allow it to fill up, and hence the cardiac output is also decreased. This entire disease pathology is called cardiac tamponade, and it presents with low blood pressure, distended neck veins as the venous blood would get pooled in the veins, and muffled heart sounds as the fluid blocks the heart sounds. This triad is called Beck's triad, all of which are seen in this patient. However, in real case scenarios, for these severe disease state to occur, including uremic effusion and cardiac tamponade in this patient, his creatinine would be a little higher than is being said for this patient as just 5 or 6. It's usually more than 7 or 8, for which dialysis then finally becomes the definitive treatment.
Otis, you've got some fluid around your heart. We need to get it off.
What's wrong? 25 in propofol, 10 cc's of lidocaine with epipericardioccentesis.
This could be fatal if not treated on time. Treatment involves immediate pericardiocentesis, which is a procedure done under local anesthesia to drain the excess fluid around the heart percutaneously using a needle. This is an imaging-guided procedure, and ultrasound would guide the needle in this case. Lidocaine and propofol are the names of anesthetic drugs.
Dr. Santos, take the head of the bed and bag him if he stops breathing. Compression until we lose the carotid.
Just making sure to maintain the ABC, the airway, breathing, and circulation.
Prep a drip to subxiphoid, please. 10 cc's of 1% width.
Chlorhexidine here, 25 or 27
No, long
gauge.
25, long 25. Thank you. Injecting lidocaine.
Anesthetizing the procedure site, which is the subxiphoid, just below the xiphoid process of sternum, with the local anesthetic lidocaine here.
Pressure down, 60/40.
Wait, you can't ultrasound in place.
I know, that's why I'm taking the probe. 18 gauge thin wall on a 60 cc syringe, please, Dr. Collins. Let's go. You're going in right over the center of my probe. Advancing very slowly, looking for the hyperechoic tip. Very, very slowly. Do not hit that hard. Dr. Santos, you see that sea of black? That's the effusion. We're looking for a little white dot. There it is.
Got it.
In the world of ultrasound, hyperechoic means white. It's usually a solid object. Hypoechoic is dark, usually fluid collection. The needle tip would have hyperechoic intensity, which is seen here. That would ultimately confirm the needle tip is in the right space for drainage.
Aspirating.
3 cc should be enough. Good. Next, we'll place the guide wire and then the triple lumen catheter.
Pulse ox is 99.
Pressure's up, 124/78.
Looks like things are back to normal.
That was cool.
Basically, there is a dramatic improvement in the vitals after the procedure.
Oh, I found her on the floor in the bathroom. She can't stop puking.
What's her name?
Teresa, she's my mom.
4 Zofrans on board.
That should stop the nausea.
Zofran is the brand name for ondansetron. Usually 4 milligrams of Zofran would be the stat dose IV accompanied with pantoprazole, and normal saline infusion if in case the patient is dehydrated from loss of fluid during vomiting for symptomatic treatment. Definitive treatment would be planned after investigations would help find out the cause of vomiting.
Potassium 3.1.
Loss of fluid from vomiting would decrease potassium levels in blood, causing hypokalemia, and metabolic alkalosis from loss of acidic fluid in the stomach. This together is called hypokalemic alkalosis. This is treated with potassium supplements like potassium chloride.
Is that bad? It can cause heart problems, but we're gonna correct it. Okay, 10 in the bag, 20 PO.
The IV and oral dose of KCl were being said here.
Oh yeah, I need a fresh set of eyes.
Or what?
54-year-old woman brought in with intractable vomiting by her 18-year-old son. I'm getting a weird vibe.
Your exam and your labs are not matching any of the usual diagnoses, so I'm not really sure what's going on.
I'm not here for me.
I'm here for David.
I don't understand. He said that you've had persistent vomiting, some
I made myself
dehydration.
sick with Ipecac.
Ipecac is a rapidly acting emetic, which was once used very commonly to induce vomiting in cases of poisoning in the ER. It rapidly induces forceful vomiting and was a frontline treatment for orally ingested poisons. Then the activated charcoal came into the toxicology scene. Charcoal was way more effective at reducing concentration of orally ingested poison and was safer to use than Ipecac. So, it's no longer used medically. However, we observe instances of misuse like this of Ipecac to fake symptoms.
To induce vomiting? Why would you do that?
My son has some problems. He needs professional help. It was lists of girls he wanted to hurt.
This is a case of malingering where the patient consciously took the drug to fake symptoms for some secondary gain, which in this case is so that her son gets the necessary counseling he needs. Another interesting thing is that Ipecac is also used by people with bulimia nervosa to reduce weight through induced vomiting.
Almost all of our labs are back on Sleeping Boy Tyler. All 100% normal.
Is he waking up?
No, he's still fast asleep.
Most of the lab results are in and they look great. No abnormal blood count, no electrolyte abnormalities, no diabetes, no kidney disease, so.
So what's wrong with him?
We're still trying to figure that out.
Did he have a play date yesterday by chance?
No, he had preschool, but he was fine when I picked him up. No, my phone tree would have lit up if someone else was sick.
He eat anything this morning?
No.
It looks like some sort of gelatin. Any chance he could have gotten into some bath beads or laundry pods?
No, and there's no such thing in our house.
What about gummies?
No, we're very strict about candy. Right?
Danny,
What about Danny?
your brother, he gave me some gummies he got in Cleveland. They were in my coat pocket.
Pot gummies?
Yes, I'm so sorry.
Let me call the lab and get back. Hey, this is Dr. Langdon from the ED. Can I fast track a lab on a little boy? Why don't we step outside and maybe you can help me figure out how much he may have taken? Labs confirm it. Your son tested positive for cannabis.
So this is an accidental case of poisoning where the child mistook a cannabis gummy as a normal candy and took it unknowingly. Due to the depressant effect of cannabis on the central nervous system, the child has experienced effects like relaxation and excessive drowsiness. This is the reason why such substances, or basically any drug, should be kept away from the reach of children. The treatment here would be largely supportive. We gotta ensure the airway, breathing, and circulation are intact. If the child has respiratory depression or low oxygen levels indicated by low SpO2, supplemental oxygen needs to be administered. IV fluids are to be given if the child is hypotensive or dehydrated. The child should be monitored in a hospital setting until symptoms resolve and effects wear off, which is typically in 6 to 24 hours and depends upon the number of gummies the child took. In cases of seizures, benzodiazepines need to be given promptly. Thanks for watching. Please support the channel by sharing, liking, and commenting whether I should make a similar breakdown of the other episodes of the Pitt or other medical drama.